Okay, welcome everybody. I'm Andy Miller. I'm in the Department of Geography and Environmental Systems here at UMBC, and I am the host for the seminar series that we're running this fall. And I'm going to just share screen with you just to show you what's happened lately and what's coming up before we proceed to today's speaker. So this is our department's seminar series. You can see that the most recent one was 2 weeks ago. We post these all on the YouTube channel of the Center for Social Science Scholarship once we get the recording back. You'll hear more about today's seminar in a minute. We have no seminar next week, but our department is inviting people to attend seminar by the Gender, Women's, and Sexuality Studies program by Dr. Elizabeth Rule. And then we have the week after that, Dr. Brian Harvey from the University of Washington talking about climate, fire, and the future of forests in the Western US. So to see any of these seminars, or even to go to our past seminar series, all you have to do is go to ges.umbc.edu/seminars, and that'll take you to it. Actually, maybe Valerie, when you're done introducing, you can just stick that in the chat. So I'm going to stop sharing screen and allow our speaker to start sharing screen. And before I do, I'm going to turn it over to Valerie Passion, who's one of our graduate students of the program, who's going to introduce our speakers, one of whom is here now. And I would say, Valerie, go ahead and introduce both of them. And if Samuel arrives a little bit later, that way people will have heard a little bit more about it.
Okay, that sounds good. Hi, everybody, and welcome to the speaker series. With us right now, we have Dr. Megan Latshaw, who is the director of master's degree programs in the Department of Environmental Health and Engineering at the Johns Hopkins University Bloomberg School of Public Health. She also serves as co-chair of the University's Sustainability Plan Steering Committee and as core faculty for the Environmental Challenges Focus Area of the Bloomberg American Health Initiative. As faculty at Hopkins, her efforts focus on designing healthy communities, connecting environmental health research with the real world, and improving environmental health surveillance, all through a justice and equity lens. And we also have with us today Mr. Samuel Jordan. Hi, welcome.
Thank you so much.
Who have founded the Baltimore Transit Equity Coalition, BTEC, in 2016 to complete the Baltimore Red Line Light Rail project and recover its transformative economic benefits for the Baltimore metropolitan region and the African American, Hispanic, low-income, and transit-dependent communities, which are adversely affected by the cancellation of the project from 2015. He has conducted community livability, issue organizing, and skills training programs in Baltimore and Washington, D.C. over the last 12 years. And as an advisor to the Washington, D.C. Department of Transportation, Mr. Jordan was honored by the National Capital Chapter of the American Planning Association in 2013 for his community livability tool called Community Livability Outreach Advisors. Mr. Jordan is a former chair of the D.C. Statehood Party, former executive director of Healthcare Now, Washington, D.C., former director of the program to abolish the death penalty at Amnesty International USA, former director of organizing for AFSCME District 20 and representative of AFSCME Local 2093 in Washington, D.C., the former executive director of the National Education Association D.C. office, former organizer of the U.S. Creative Solidarity Initiative. Mr. Jordan holds a Juris Doctorate from the Georgetown University Law Center. And without further ado, we are ready to start the presentation. Thank you so much.
Thank you.
Samuel, do you want to take it away?
Well, yes, I think so. And thanks again, everyone. And I am glad we have an opportunity to speak again this afternoon about our project. As many of you have noticed, perhaps, there was a bit of a splash when the media began covering what turns out to be Baltimore's first transit equity analysis. Well, this actually was born in necessity. There are a number of steps to getting the project underway, but BTEC, that's Baltimore Transit Equity Coalition, BTEC, was engaged in the discussions about how a cap and invest system called Transit and Climate Initiative would identify the communities that should be targeted for investments in transportation, health, and environmental protection, frankly, from emissions generated by the transportation sector. And there was no real plan to do so. Putting our brains together, coming up with some ideas. I would talk to Dr. Latshaw at Hopkins with an idea, a simple idea, pretty straightforward. Let's do a mapping project that will overlay issues of transit equity, health impacts, what we call a social vulnerability index, and pollution. And that overlay should result in identification, accurate and precise identification of the communities most in need of investments and interventions from long-term impacts of transit sector generated pollution. And that project, that collaboration has resulted in what is frankly an important instrument that we would hope will be used statewide and in other jurisdictions, but nevertheless, the origins of this began first in our attempts to address issues of structural racism in public transportation. And what we found, of course, in the study for the Red Line preparation, I spent 9 years of my own life doing that, but what we found is that we're doing more than looking at questions of mobility, that public transportation and the transportation sector generally have a much broader impact and intersectionality on questions of housing, healthcare, food security, employment, and education. And of course, when we work with and are familiar with the work done by Dr. Latshaw at Hopkins, we know that she's also greatly interested in the social determinants of health. Public transportation and transportation generally are important determinants of health. So that was a perfect combination of interest and intention and capacity. And that capacity, certainly for the technical work, was provided by the team that Dr. Latshaw assembled at Johns Hopkins. That's what I would call just an introduction. But the key to it all is we wanted to make sure that policy to address the questions that we found or were disclosed in our research was based on actual data and no longer simply anecdotal. One last comment on this part of our discussion. We're familiar with the identification or labeling by Dr. Lawrence Brown of the black butterfly and the white L. Well, to date, while important and descriptive, and frankly accurately descriptive on a number of social issues, and particularly housing and the spatialization of racism in Baltimore, it was often anecdotal. No one could really say, well, how bad is it based on the data, comparing one neighborhood to another. Our project set out to answer that question and provide a data and factual basis for the policy that should lead to interventions.
So, just to give you guys some background before I jump into what we actually did, transportation is more than just getting around, right? Transportation can also be the difference between access and isolation. It can simplify getting to your job. In Baltimore City, getting to school. School students use public transit in Baltimore City to get to school. It can help you get access to healthy food and healthcare, right? So there's lots of different things that transportation opens up. And the communities that rely on public transportation, though, sometimes have the least access, right? So public transportation is really important to residents that might not have a car. Maybe elderly residents who don't feel comfortable driving anymore, or disabled residents who can't drive, and especially to low-income households. But those are the groups that often have the least access, right? So this connects to air pollution because all vehicles that burn gas release emissions into the air, right? And traffic and congestion contribute to that even more, because as we idle in traffic or congestion, we're burning fossil fuels, and starting and stopping vehicles also contributes to air pollution. And air pollution leads to worse air quality, right? And that leads to respiratory conditions like asthma and COPD. So consolidating riders creates more efficient roadways. It reduces traffic and congestion, and it also reduces air pollution. And why do I work at a school of public health, why do I care about air pollution and transit? In particular, I care about them because poor air quality impacts our health across all of our body systems, not just the lungs. And it's, you know, vehicles, not only when they're emitting air pollutants, they're also emitting greenhouse gases, right? And so that contributes directly to climate change, and climate change impacts health in all sorts of different crazy ways, from, you know, more mosquito-borne diseases and increased allergies and increased flooding and so many different things. And a really interesting statistic that struck me when we were working on this project is communities that have a strong public transportation system, they can reduce the nation's carbon emissions by 37 million metric tons a year. So public transit not only reduces air pollution, but it also reduces climate change. So those are some of the connections between why we decided to do those 4 maps that Mr. Jordan talked about. The first map that we did was on transit, and we looked at 6 indicators when it came to transit. So we looked at the average commute time. We looked at the difference in average commute time if somebody who goes from their house to their job. We looked at how long it would take them if they took public transit, and we looked at how long it would take them if they drove a car. And then we took the difference between them for this indicator. We looked at how close people lived to a high frequency transit stop, because just because you live close to a transit stop doesn't mean that the bus comes there regularly, right? We want high frequency. We looked at the number of stops that people lived near. We looked at the percent of the population commuting via transit, and we looked at the percent of the population who had a commute time greater than 45 minutes, which is a lot of people who use public transit in Baltimore City. So here is a map of the distance to high frequency transit stops. The red indicates areas for opportunity, so where we might want to invest. And it's not surprising, right? The downtown Baltimore area has the most transit stops, so that we kind of saw what we expected to see. This is what the map looked like for the number of stops that people lived near. This was a little bit more surprising because, I expected more stops to be near downtown locations too. But what wasn't too surprising was you can kind of start to see what Mr. Jordan talked about, that white L, right? So this is where areas in Baltimore were historically redlined, and Black and brown people couldn't live there. And so it's interesting that that white L is exactly where there's lots of transit stops. This is the percent commuting via public transit. And this is where you start to see that black butterfly that Mr. Jordan mentioned. Again, when Baltimore was redlined, most of the Black and brown populations were living in this red area that sort of looks like butterfly wings. And so they're the ones that are taking transit. Again, not surprising. This was the percent of the population that had a commute time greater than 45 minutes. And you can kind of see that the areas that were the hardest hit or had the worst commute times were the ones that were not really living down near the city center. Again, not too surprising. Here's the average commute time via public transit. Here again, you see that white L and you see the black butterfly. And here's the difference in average commute time. And this, again, wasn't too surprising. The people with the longest commute times live the furthest away from the city center. So it's going to take them longer. Maybe they'll have more transfers that they have to do. And here is we put all those different indicators together into one map. So this is one of the final 4 maps that we did. This is called our composite transit map. And again, you sort of see that black butterfly and white L. Second set of maps that we looked at were on social vulnerability. So what do we mean when we say social vulnerability? This is an index developed by the United States Centers for Disease Control and Prevention. It includes socioeconomic status, like how many people in that census tract are unemployed. It includes household composition, how many people are elderly. It also includes disability, minority status and language, housing type, and transportation. So we mapped, here's the composite map of all those things combined into one. Again, you see that white L and the black butterfly. Here's minority status and language. I'm not going to spend a lot of time on every single one of the underlying maps. Socioeconomic status, housing type and transportation. If you have questions about any of these, we can always go back. I want to save as much time as possible for discussion. Housing composition and disability. And again, there's the composite social vulnerability map. So then the third area that we looked at was air pollution. And for this, we had 5 different indicators. We had particulate matter, smaller than 2.5 micrometers, so very, very small. We looked at ozone. We looked at diesel particulate matter. And we looked at this hazard index. It's basically sort of looks at a whole bunch of different air pollutants that have an impact on health. It includes NOx and SOx and carbon monoxide and lead. And then we also, lastly, we looked at traffic proximity. So how close the census tract was to traffic or major roads. So here's our composite air quality map. And you might think, well, I hope you would think, it looks like there's only like sort of, there's not a lot of detail and it's not very variable. And that's in part because there's only 3 air quality sensors, EPA air quality sensors in Baltimore. And so, you know, given the fact that there's just 3 sensors, the rest of the map had to be modeled. So we don't really have data down at the sort of local level for air pollution. And I think that's a big problem. I think that's something that we need to do something about. You'll see that our indicators are all pretty high, right around the Inner Harbor area and the Patapsco River and downtown. And that's probably due to the port industry, the incinerator that's down here, and also just downtown traffic. Here's PM2 particulate matter, less than 2.5 micrometers. Here's ozone. Diesel particulate matter, this is probably where all the trucks are driving, right? Respiratory hazard index, these are the ones that we worry about for health impacts. all of them that we selected, we worry about for health impacts. And then traffic proximity, you can see it really mirrors where I-83 cuts through downtown, the Jones Falls Expressway. And also 895, the Baltimore Harbor Tunnel as well. And then here's the composite map again, where we pulled all those different indicators together and mapped them as one air quality map. And then lastly, we looked at health. And for this one, we had 6 indicators: asthma, COPD, lung cancer, COVID-19, heart disease, and low birth weight. And here's our composite map for health. You can kind of vaguely see that white owl, maybe the black butterfly a little bit, but not as strongly as we saw for transit and for social vulnerability. Definitely see that the white owl black butterfly pattern with asthma and with COPD. Not as much with lung cancer. And kind of the reverse a little bit, maybe with heart disease, which is interesting. You know, we were thinking maybe it's because access to healthcare, maybe people in the white owl are catching heart disease earlier. Heart disease was actually, we didn't have a good data set for heart disease. So what we used was hospital discharge data for myocardial infarction, which basically means a heart attack. So that doesn't necessarily, I mean, heart disease can lead to heart attacks, but you can have heart disease and not have a heart attack. Or maybe you can have heart disease and you can go in the hospital and not come out. So it wasn't a great indicator, but it was the best that we had access to. And then here's COVID-19 data. Again, you kind of see the opposite of the black owl and white butterfly. And we thought again that this might be that people who live in the white owl are more likely to get tested for COVID-19 and thus be recorded as having a positive case. We're not certain. Here's low birth weight, kind of a random distribution. And then here again is all of the different health maps pulled together into one. So we took those 4 overall maps, the transit map, the social vulnerability map, the air pollution map, and the health map. And we combined those 4 into one overall composite investment map. And this is what we got. Again, the darker color indicates a higher need for investment. And basically, you see that white owl, black butterfly pattern, sort of. We presented these results to the Baltimore Sustainability Council, and some of their feedback were, well, you know, COVID was kind of weird, and some of the air pollution data, because you only have 3 sensors, that was weird. What happens if you pull those maps out? Does it change the results that much? And what we saw is if we took out air pollution, we saw a larger number of high need neighborhoods throughout Baltimore. If we took out COVID-19, that actually decreased the density of high need neighborhoods. So what we decided to do was just to leave all of the maps in, the original maps that we planned to include. And you know, it didn't seem to change the results too dramatically. And Samuel, I'll turn it over to you to talk about sort of the neighborhoods and what we plan to do next. And you're on mute, Samuel.
Unmute.
There you go.
Thank you. And certainly we'll have a few questions about Dr. Latshaw's comments, because they generate quite a bit of interest as to what happens next. These encircled areas, as you can see from our composite neighborhood, with neighborhoods in the margins listed by name. There are quite a few in the city of Baltimore, as you can imagine, but these are areas where we know we need to direct policymakers' attention. And these are areas that we would say are in desperate need of investment. So we want to get immediate attention with discussion of just what ways in which we engage the communities in these areas that need such investments in helping to solve the problem. We need to avoid making it kind of, we have all the data and all the answers, and we'll parachute in and tell you precisely what to do. Community members have an experience with health and asthma, of course, among the young, COPD. So we are going to take a more collaborative approach, collegial approach, in that we will visit, we'll target a few or identify a few of the communities that are most in need and visit, discuss. We've already begun that process. And I can tell you that the reception we've gotten to date is not just simple curiosity, but the idea that maybe there's some possibility for relieving the stresses that many members of these communities have experienced. So our approach is to make clear a few things. One is, these are findings from a fact-oriented, of course, fact-oriented research and study. They're not answers to issues. And we're being careful not to traumatize the communities with the discussions that we might offer or with the facts that we may be able to present, but to simply note the fact that many of them are aware of these problems, but we want to now show what the data indicates that might even reinforce some of their concerns, some of their own experiences. But nevertheless, our approach is that a community engaged review of the data, a community engaged participation in assessing the impact of these health impacts, of the pollution impacts. They are not only public, but personal, of course, and they may even be economic. We need to find that, but the communities will let us know that. But then we want to engage the communities in a preliminary stage, at least, of designing an intervention tools that are appropriate to what we found, what the data reveal. And I would also add that the data that we have, I think Dr. Latshaw has mentioned it, we need more accurate data. We need more complete data. We need to make sure that the policymakers and the communities know that the whole city of Baltimore having only 3 EPA monitors is simply untenable. I mean, what does that mean? It means we haven't given enough attention to this question in the past. So not only was I surprised that the city, that the MDOT-MTA had not conducted a transit equity analysis, the city had not conducted a transit equity analysis, and the city had not conducted a discussion or analysis of these intersections, but particularly here, transportation and public health and transportation and pollution. Our approach obviously is not to upbraid the policymakers. Our approach is to say that we've long needed and waited for the data, and as opposed to anecdotal references to these issues. So the first stage was to look at the city of Baltimore. The second stage is to apply the methodology to the region and then perhaps to the state. But I would say that we are doing what we might call at least the first stages of a pilot project, rather than waiting for all the stars to align and then give us the kind of resources and support and funds that we would need to do a citywide, region-wide, then statewide analysis and application of our methodologies. We're going to try the idea of identifying several communities, 2, 3, 4 communities, engage with the community residents and leadership, and begin this kind of approach. I think you're familiar with this idea of participatory action research, PAR, which means let the people who need the data also learn how to get it. So ours is an engagement of with the communities. Now, I have a note on my screen that says subtitles aren't available right now because the speaking voice is too quiet. Am I speaking too quietly for you?
We're fine as far as I can tell. I wouldn't worry about the subtitles. They're never accurate anyway.
Good enough. They're doing pretty well. They did fairly well with Dr. Latshaw's presentation, but I see it now for the first time. Now, so that actually is our approach to the neighborhood. Strategically, it means we're answering hoping to answer a lot of questions at the same time. Remember that our initial imperative was transit equity analysis and what accompanies that. And what we're getting is not only a discussion about these issues, health impacts, pollution, but also what happens with the transit system that need to be addressed. What happens with the red line? What happens with what's called Baltimore Regional Transportation Authority? We'll mention that perhaps later before we end our seminar, but we need concrete solutions. And most importantly, we need solutions that address the fact that public transportation policy, healthcare policy, even environmental issues, and where the routes are that carry the most trucks and buses, these all have a common root in race-based transit policy, race-based public policy. So our overall thrust, and we don't want this to be missed at all, because we're going to need your help to keep this high in the news cycle, but as a matter of public education, the basic and fundamental issue raised by these recall and emphasize Baltimore's segregationist past and the need to halt it now. We should have learned something from the pandemic. We can't go forward with for a prosperous Baltimore, nor for a healthy population, nor to fight the ravages of climate change and environmental destruction if we don't address these questions now, which means eliminating the racial basis for public policy, not only transportation policy. And when we can do that, Baltimore can make the kind of, can achieve the kind of stature it should have as a city. And we can live in a place that's livable, walkable, breathable, workable, as we should, with a vision for the city that comes from data being the basis for public policy.
And I'll just add, you know, one of the key parts of this project and the goals is informing legislators, right? So a bill was introduced last year, House Bill 1204, that was called the Transportation Equity Analysis and Assurances Act. This is the Maryland House, just in case that wasn't clear. And also, we know that the Department of Transportation, the U.S. Department of Transportation, is interested in helping other jurisdictions do transit equity analyses. And so we're hopeful this can be a model for them. PennDOT in Pennsylvania has asked about our methods, and also the US EPA. So, you know, beyond just our Baltimore piece, we're hoping to influence things at a much larger level. So this is a link to download our report. There's also a 2-minute video featuring Mr. Jordan that summarizes the report. And this is our team that kind of pieced this together over the past year. And it's constantly changing. We have people rotating off and new people rotating on, but for the work that we just presented to you, this was the key team. And then, you know, because Mr. Jordan and I are always trying to get feedback and thoughts, we really wanted to spend as much time with you guys as possible talking today about like your reactions, like, what do you think of this? Do you have any experience with these issues? Did we miss anything that we could include in next iterations of this work? And again, what else should we be thinking about? So we have questions for you. Hopefully you'll have questions for us, and we can spend the rest of the time in dialogue.
Thanks so much. I want to invite everybody here. If you have questions, I see someone just posted. I have 2 questions. I have to make my chat screen bigger so I can see who that was. So we're going to invite people to post questions in the chat, and we already have a couple of questions to ask. So I'm going to start with Dawn Beeler.
Hello, thank you so much for your talk and this really comprehensive work that you've done. I'm just really impressed at how much data collection is going into it. I would love to hear really specific things that folks can do to support the kind of solutions that you'll be developing by taking this report and working with communities. So that's kind of my simple question, but maybe the more difficult question is, I'm trying to formulate this. Basically, the folks who have been living with the air pollution and the lack of access to transit have known these problems for a really long time. They have daily lived experience of this. And yet it seems like it always, with situations like this, takes these really these big rigorous data studies to get attention focused on the problems, and then even then it's a really long process to turn that data and the community's really hard work into any kind of outcome. And it seems like in lots of environmental justice situations that's the case, whereas attention in a typically white or affluent community, attention gets paid to those issues, similar kinds of issues, instantly. So I'm wondering if you can speak to that challenge of like spending so much effort and time in gathering this data for communities that already know what problems they have and have been waiting a long time to get those problems addressed. Like, do you think there's a way we can make it easier for communities to just express their concerns and get their needs met? Or what comments do you have on that problem? Thank you.
You know, I'll take a stab at it initially. It's a very important question, frankly. But what we know at BTEC is facts are the enemy of racism. Okay. Racism is strongest when there's no data. Racism is strongest when there are no facts to justify making structural change where we find structural racism. These data that we've collected in this project are the basis for policy changes and structural changes. So our structural change, for example, is to complete the red line and to create a Baltimore Regional Transportation Authority that will address these intersectionality issues, public transportation and health and environment among them. So I would say that, one, we can use your help. In fact, everyone who's interested in working further with us, we'd appreciate if you meant the moderators of the call will let us have your contact, or you can put them in the chat, however we can get them, because we do need to follow up. But with a massive, organized, with an important constituency, an informed constituency. Now, there's another part of your question about the fact that participants or members of these communities are familiar with these problems, okay, and know that something is happening when 50% of the children in their neighborhood have asthma, for example. Where is it coming from? How do we explain this? Well, there's been very little education, public education, that seeks to provide communities the instruments, the tools with which to determine the extent of the problems, to determine their cause and their origins. Okay, so we are introducing in a social context where facts have not always been generated, particularly when we are addressing race-based public policies, here in the case of transportation. So we're asking Baltimore, we're asking you, and anyone we can speak to, that we can use your help in making this case. One, when we find structural racism, we have to make structural change, but more specifically on this issue, we want to have a corps. I don't want to call it an army. You know, we don't want to use too many military references any longer, but we need scores of interested students like yourselves, for example, who want to help us reach out in an organized way to the communities, as many communities as possible, not just to 2 or 3 that we might select for a pilot project. So Dawn, you and your colleagues, your peers, are welcome to work with us and develop along with us the plan that we want to use or implement that will reach out to the communities, engage with them in discussing these issues, You don't have to be PhDs in public health. At Hopkins Bloomberg, it would be great if we had a few more working with us like Dr. Latshaw, but we can make that, that's the first step. So it can definitely help us with the first step. Second step is to alert your networks to the nature of this problem, because we're going to have some days in which we're going to ask for as many people as possible to send a letter to the mayor, to send a letter to the Department of Transportation, to send a letter to the state as well. We don't expect a lot more to happen with Governor Hogan, but we do need a transit-friendly and a community health-friendly governor. So I think just to put the question, that issue is that we want a broader application of the methodology. We want immediate investments, but we're going to have to fight for it. None of this will drop out of the ether. Hasn't in the past 200 years, so we can't expect it to happen now. But your assistance with your interest, our identification, you let us know who you are, and we can also work with you to develop that plan.
Samuel, I just pasted BTEC's action page in the chat so that they can go to that page and see some of the actions that you've talked about.
Thank you.
Yeah,
Thank you much.
absolutely.
And I would like also, if the moderators will do so, I'm not sure I'm using the chat function well here. My email address is samuel.jordan@moretransitequity.com.
I will type that in a moment, or maybe Valerie, you can do that.
Thank you.
So thank you very much. We have, I'm glad you left time because we got a lot of questions coming up.
Great.
We're going to go next to Joe Gallagher and then Dylan Mahmoudi.
Hey, hopefully everyone can hear me. Okay, great. Thank you for this amazing analysis. I'm looking forward to next stages. One of my questions kind of relates to that. It seems like smart card or smartphone and banking access is going to become more and more of a barrier. Baltimore has already implemented like a mobile ticketing app for riders to use to board buses and other transit. And also the provision of real-time information, arrival information for buses that makes riding more convenient is bound to a smartphone app. So I was wondering if you guys would, if you guys considered including smartphone or banking access into this analysis, as these, to me, definitely constitute barriers to transit equity in the city. And then my second question is about, do you think it's possible for equitable transit to be delivered using buses? Because just thinking how that was sort of Hogan's lopsided compromise was redesigning the bus network to sort of be more rational or run more frequency and resemble a rail network. But how that's played out is another story. Anyway, those are my two questions. Sorry.
Mm-hmm. You know, again, I'll take a stab at the immediate response and briefly so that we can get to some of the other questions as well, because you asked a very important question. This issue of buses, this issue of the apps, we can speak to, because, you know, that is an issue of the uptake of the new technologies by riders themselves. Not all of the riders are informed and use these apps at the moment with the mobile ticketing and so on. They're available, but the word is getting around on those. But with respect to this issue of buses and rail, in a few months ago, well, a month ago, the Maryland Matters, pretty authoritative and well-respected periodical, published commentary in which we talked to called Senators Thank You, Mode Matters. Well, mode matters refers to the fact that rail, buses provide a different solution, if we're seeking solutions, a different kind of support for issues of transit equity. Briefly, the crisis facing Baltimore is not one of simply getting from point A to point B. Okay, that's supposed to be what a bus does. But then if you have a bus to do that in a dysfunctional transportation system where there's no reliability, no on-time performance, extremely long commutes, and no real regard for the real convenience of the riders, obviously you can't increase ridership, and you're not serving well the people who do use the system. That's exactly what we have here. This is a bus question versus and cars and the mode. You see, we're hoping to put to rest the autocentric culture. You know, there was a streetcar period, then cars dominated. People were trying to say that was just General Motors and the real estate industry trying to make a couple $1 trillion. They did, but we're introducing now what might be a new rail era, because light rail has proven over the last 6 decades to be the most robust generator of economic development in the country, and there is no competition. For those of you who might know this, but maybe not be as old, with direct experience, well, the difference between Washington and Baltimore since 1975 is the DC Metro Rail system, okay, because it delivers what has proven to be the most authoritative indicators of upward mobility and community stability. That is, having reliable, serviceable, equitable public transportation system. That's the Raj Chetty study of 2015 in Harvard. We can always put a reference to it in the chat. But when there are issues about transit crises, as we're having in Baltimore, the most common race-directed and race-influenced proposal is just throw another bus at Black and brown people and don't spend a penny more, when that has proven to be unreliable. 6 years has taught us that the Baltimore Link, which was thrown as a consolation to Baltimore for $135 million, which we haven't seen in the budget anywhere yet, supposedly alternative to the Red Line, a $2.95 billion project that would also generate $3 to $6.5 billion in transit-oriented development. There are no transit-oriented development or equity improvement projects associated with the Baltimore Link whatsoever after 6 years. Buses don't develop. In fact, the mantra in the industry is development follows rail. Buses follow development. Banks don't invest in bus stops. We can't make it any plainer. So this idea of buses, but see, when we say let the autocentric culture be buried, or at least put in the Museum of Antiquity, we're talking about the fact that we don't get the kind of additional needed development support for Baltimore from another bus on the road, another late bus, another breaking down bus, disrepaired bus, or a bus that needs a lot of repair. Baltimore leads the nation in disrepair for its transit system. So rail is what's best to anchor the kind of equitable, reliable, regional public transportation system which we advocate. So you're right, buses won't do it. The mode matters. That's what that article is in Maryland Matters. The mode matters. And buses don't deliver. When they do deliver, they're only getting us from point A to point B. They're not addressing issues of transit-oriented development, the $3 to $6.5 billion in transit-oriented development that we could have in Baltimore, compared to, for example, the $12 billion that have already been dedicated, committed to the Purple Line that runs from Bethesda to New Carrollton. We need that here in Baltimore. Buses won't deliver that. Buses don't deliver any discussion whatsoever about the intersectionality that we should see, that we should explore, examine, research. MDOT-MTA has not done that, so we're replacing it. That's the structural change we want to make. So you're right. This question about cars, buses, and which mode will make the difference that Baltimore needs now is actually being settled by the facts.
Thank you. We're going to turn now to Dylan. Dylan, you said you had a couple of questions.
Yeah, thank you so much, both of you. That was such a wonderful presentation. I wanted to start by echoing Samuel. You said that racism is strongest where there's no data, and that just really stuck with me. We've been talking in one of our classes about how obfuscation works to promote racism and how it's purposeful. the question, so along those lines, one of the things that I was kind of curious about with that last composite map that you showed was, well, what's the population of people that live within the areas that have the most need versus the areas that don't have that need? And then, of course, what's the racial breakdown and what's the perhaps median family income or median household income of those different kind of clusters or those different gradations? And then the second question that I have kind of builds off of what Joe was just asking. I'm curious about the shape of transit lines in Baltimore. One of the things that I've seen is that the shape looks like it's more to serve suburbanites going to downtown rather than serving urbanites to get around the city. And I know that this has been noted by other people, in particular Amazon, when Baltimore City, when Amazon expressed frustration to the city, and Baltimore City gave Amazon $100,000 to have its own shuttle service to get employees from Baltimore City to its BWI 2 and BWI 5 warehouse. So I was hoping you could comment a little bit on that.
Dr. Latshaw, you want to take the first part of that question?
Sure. So
Okay.
it's a great question. I always have to think about the denominator, right? So for most of our indicators, there was a denominator. So it was over, the number of cases of COVID over the total population in that census tract or census block. But you're right. I think it might also be helpful, and we didn't do this, to go back and look at that denominator in the areas that we identified to see how many people are actually living in these neighborhoods that we identified. I think that would be really cool. So thank you for that suggestion. If that was a suggestion, I think it was a question, but I'm taking it as a suggestion. And then also, yeah, so, the social vulnerability index looked at race, but then we didn't go back and sort of say, in these neighborhoods, what is the racial composition? We know that it's predominantly Black and brown. I mean, the city itself is predominantly Black and brown. And then, if you don't live in the White Owl, then you're probably, where the neighborhoods are probably mostly Black and brown. But it would be nice to put a number on that for those neighborhoods that we identified, and we didn't. So thank you.
Now, for the second part of that question, with respect to the shape of the routes, bus routes, for example, as you know, in Baltimore's segregationist history, Baltimore is the capital of redlining. 1911, Baltimore was the first city in the nation to legalize racially restrictive covenants in land, home loans. In fact, the government took part, that's how we can call it structural racism. Government participated in the imposition of the race-based policy. The home loan office, federal government oversaw this redlining. Well, that redlining is part of a pattern in which the segregationists, who now might be the insurrectionists, but the segregationists always wanted to command the mobility of people of color. They can't let them go wherever they want to go. They got to stay on the plantation. So redlining is part of that kind of control mechanism. Public transportation is racially conflicted wherever people of color live, but public transportation has also served as a control mechanism to contain, to isolate, in some cases to punish communities of color, but always to control the mobility. In fact, there's a Netflix series or a Netflix special called Driving While Black. It's almost the history of my family's move from apartheid North Carolina to Washington, D.C. Now, what I'm getting at is this, that these routes, you're absolutely right, serve the wealthiest communities and heap a great deal of inconvenience and long commute times on communities of color, modest income households, people who rely upon public transit, including our essential workers. Examples you have given, Trade Point Atlantic, Amazon, FedEx, Under Armour, out on Trade Point Atlantic. Well, they simply got together with a few business types, industrialists from Baltimore County who wanted to develop in that area, and simply asked the city and MDOT MTA, look, give us a route. Give us a route, and that's the number 63, has now been made an express route to go out to Trade Point Atlantic, based on their request. Now, how long have a couple hundred thousands of Baltimoreans, black and brown, who've needed a break and some efficiency and frequency and reliability in their routes, have asked the same questions, demanded the same service, haven't gotten it. Okay, that's also because the combined administrators, imposers of this type of policy, they're not looking at relief anymore. They're looking at patterns, and they're stuck with the patterns. When Governor Hogan canceled the red line, he did more than simply cancel the red line, but he demonstrated his allegiance to Baltimore's segregationist policy in all things public policy, particularly in transportation. What he was saying to African American, Latino, people of color in this city was that this was a punitive, aggressive reinforcement of the status quo. And the status quo has always been punitive to people of color. The governor brooked no discussion of it. In fact, he didn't consult. And when we filed the first of two Title VI administrative complaints against the governor and the state, he never answered. So there's never been any study, analysis, or report that corroborates any reasons that Hogan may have given for canceling the red line, particularly his claim that it was a boondoggle. But anything you do for people of color, Black people particularly, and children, is always too expensive. So we got this same, so we're trying to break out of this complex. It's a syndrome here in Baltimore. And we're looking at these patterns that you've just described. They are indeed patterns that serve. In fact, Ruxton, those of you who know that community here in Baltimore, has no public transportation stops whatsoever. They didn't want any people having access to Ruxton who had to use public transportation. If they had to use public transportation, they were obviously not the people that we need, because we've saddled public transportation with a stigma. But this is all the work of a hype. We've been subjected to a learning curve fostered by those who can profit from racial division in this society. Baltimore doesn't need it. We can reject it. We can overcome it. I want to just mention this point. There are millions of people who believe we can fight racism. There's only a handful who believe we can defeat it. BTEC believes we can defeat it. You can help us defeat it.
Thank you. So I want to just point out, we're getting pretty close to 1 o'clock. When we have a lot of questions, if our speakers have a few extra minutes, we don't need to cut it right off unless you need to go. So before I go any further, I'll just ask, are you able to stick around for a few minutes, or do we need to wrap it up?
I cannot. I have to go set up the room. I'm teaching at 1:30. But I am more than willing to continue to engage. I just put another item in the chat, and I just want to draw Samuel's attention to the fact that Bella says she met you at the 32nd Street Farmers Market, and she wants to maybe work with you on setting up another table at another farmers market. So I know you weren't looking in the chat, so I just wanted to point that out. And Samuel shared his email address. I'll share mine. And thank you so much for inviting us and for your interest and your support and your great questions and suggestions. And yeah, it's been a pleasure.
Right.
Thanks,
if you don't mind, Dr. Latshaw and Andy, if there's some other questions that I can respond to, sure, I'd be glad to stay a few minutes.
That would be great.
Would it be okay? Okay.
Yeah. So Megan, if you need to go, please go. Thanks so much. I will tell you, this engendered more questions than any of our seminars so far this semester. So it's clearly raised important issues in a lot of people's minds. But rather than keep talking, so there's several people who posed questions and then they were answered in the chat. I don't know if they want to ask those questions. And then one of our faculty had a question but had to leave to go to a meeting, so he asked if I would do it. So I'm just going to go in order of the people who raised the questions and asked if they wanted to ask them. One was Emma Gilligan, one was Anisha Jayadevan, and then it was Matt Baker.
Sure. Can we make sure that Bella leaves her email address? I think I just saw a note that says she'll see us on Sunday at the tabling.
Bella, put your email in the chat. I'm going to save the chat and we'll post it. We'll post a link to it.
Okay.
So Emma, did you want to ask your question or did you get an answer?
Good. All right.
Did she say yes? I can't.
She said that her question was answered in
Okay.
the chat. So did Anisha.
Okay. So I am going to ask Matt Baker's question, which I think is also an important one, and I had my own addendum to it when I saw it.
Okay.
It gets back to this question about the county versus the city. And I think that Megan said something in response to this, but I think it's worth having it on the recording. When we get to your question, oh no, that's him, that's me. His question was, what are the implications for performing this analysis in isolation from the surrounding county and its population, labor market, transit system, and healthcare? Is it an assumption that the economic center of the region for transit and commuting persons will remain in the inner harbor port and / port of Baltimore? And I just want to add to that, the other related issue is that you've kind of implied, but we haven't addressed directly, is not only the environmental health consequences, but the importance of the fact that a lot of the jobs have moved out of the city, particularly low-wage jobs are out in surrounding areas. And the neighborhoods you've talked about are where people don't have access to transportation and where it can be a 2-hour commute to get to someplace, which could cause you to lose your job. So these things all seem to roll together. So this
Yeah, they do. They do.
Regional piece of this.
Right, and I want to respond immediately, and thank you, Andy, in the sense that we did the study data is limited to Baltimore only because we had the data available to us immediately. Okay, but that's only phase 1, the city, and it's important that it's phase 1 because Baltimore should, as the highest concentration of people of color in the region, should also take the lead on some of these questions and show how it might be done. Maybe we'll get some best practices if we can get an early responsible response from the city leadership. But so we are not limiting the research. Was that Mac, someone who asked that question?
Yes.
Yeah, we're not limiting the research to the city of Baltimore. That was simply the first stage. We're in stage 2 now, where we're applying that data to the region, Baltimore City, Anne Arundel, Howard, Anne Arundel, Hartford, Howard, and Baltimore counties. Those 5 jurisdictions constitute the region that we're referring to when we speak about the Baltimore region. Carroll County did not want to be bothered at all with public transportation bringing people into Carroll County. Queen Anne's County, which has also been included in the Baltimore Regional Transportation Board by Governor Hogan, is across the bay. Why he would put it in this region is a political question. It would dilute the voting strength of Baltimore City and Baltimore County. So we're always fighting that. Remember, racism never sleeps. It's like rust. It's destroying the whole machinery of the society, destroying the economy, destroying the environment, but doesn't sleep. And we're always fighting it. And it happens in the open public square. So what I want to make sure is that we cover this. We're not limiting the study to the city. We are now working on phase 2 and thus applying the methodologies to the region. We want to apply these methodologies to the entire state. So we have sought a way to codify at least the methodology without what might be a prohibitive fiscal note on the legislation. HB 1204 was introduced in the last legislative session. It will be renamed and renumbered, I'm sure, for this legislative session. It will be called, in this time, the Transportation Equity Act. In the last session, as Dr. Latshaw mentioned, it was called the Maryland Transportation Equity Assurances, Equity Analyses and Assurances Act of 2021. Okay, what it does though, in the new iteration, contains some language, a few lines that refer to a process, an instrument like ours that can be used. So can be used suggests that it's not mandated. So it's not mandated in the act. Can be used. We're trying to dance a legislative dance and a political dance, and we're non-partisan altogether. But that's going to be something, if we don't get it codified, if we don't make a shift in power, that is, make structural change where we find structural racism, we really haven't moved the needle. So that's the gravamen of our effort. And I think I would stop there, but I would say that the well, one fact, just a couple of factors, if you don't mind. If you have a car, if you are driving by car and commuting, for example, work, you can get to 100% of the jobs in this region within an hour. That's for sure. You know that. But if you're using public transportation, you can only get to 9% of the jobs within an hour. 2 out of 3 jobs in this region cannot be reached within 90 minutes by public transportation. That means that if you're lucky enough to have one of those $9, $10 an hour jobs out in the county where they have moved to, escaping the city, then you're still going to be held captive 3 to 4 hours every day without being paid by a dysfunctional transportation system. Well, who does that happen to? It doesn't happen to the wealthiest, whitest auto drivers in the region or in the city. It only happens to people who are dependent upon public transportation, don't have access to cars, and can't find employment suitable for them or for which they might qualify in the city any longer. Okay, so the auto-centric culture gave us escape from the city. Okay, such a stigma was attached to public transportation that you'd be sort of declassed or declassé in your own circles if you live within 2 or 3 blocks of a Black person. I mean, you got to justify that in some places. So we're not making use of creative density in the city. We need a new vision for what a city should do for us in this time now. We're handling multiple crises, and we should not let any good crises go to waste. And that's exactly how we're treating this issue. So I want to stop there because these issues that you have raised about the roots are a legacy of redlining. When communities, Black communities, were isolated, were Bantustans rather than communities, and isolated from other parts of the city. Well, the ridership and the routes were based on that. We want the Red Line as an east-west corridor, east-west transit, 4.2 miles, 19 stations, 54,000 miles per day, and with dramatically reduced commute times. We want that to be an anchor for a rationalized public transportation system. That is, the bus routes can feed into the 19 station areas, transit hubs, on their way to other places, destinations that have been found to be where people want to go. The Baltimore Link was launched without an origins and destination study, meaning that M.MTA had no intention of knowing exactly what people needed in the first place.
I think with that, I'm really glad you were able to stay for a few more minutes because I think the last response you gave is both really compelling and an excellent way to sum this up and pointing to where we need to go. So I thank you and Dr. Latshaw on behalf of our program, and I hope that we'll have a bunch of people who will watch this video and learn from what you've had to say.
Well, thank you much. And if you would share that, obviously, the video with us, I would imagine you will.
As soon as
and
we get it
those
back,
who,
we'll put up the link and we'll send it to
those who will work with us, not only those who've seen us at the 32nd Street Market or the JFX Market tabling, we need lots of tabling work going on and petition drive support. We can talk about that, but let us have your contact information. You have mine, and we can follow up. And that would constitute a practical and concrete follow-up to a discussion like this. Thank you so much for your invitation.
We will make sure we get all that information back to you.
Andy, thank you.
Okay, thank you. I'm going to stop the recording now.